Hello, my sunflowers, and welcome back to my channel. Today, we're going to dive into a topic that is incredibly important but still so often misunderstood: mental health disorders. Mental health is the foundation of how we think, feel, and navigate our daily lives. Yet, there's still a lot of confusion and stigma surrounding it. In this video, I want to gently walk you through some of the most well-known mental health conditions like PTSD, ADHD, bipolar disorder, and many more, in a way that's simple and easy to understand. Before we begin, I want to make one thing crystal clear. This video is not about labeling, diagnosing, or judging anyone. It's about building awareness, fostering empathy, and promoting education. Because the more we understand, the more compassion we can show to ourselves and to others. So grab a cup of tea, get comfortable, and let's get started on this journey of learning together. First up is PTSD, which stands for post-traumatic stress disorder. This condition can develop after a person goes through or witnesses a deeply traumatic event. This could be something like combat experience, a serious accident, physical or emotional abuse, or even a natural disaster. Someone with PTSD might find themselves reliving the event through vivid flashbacks or recurring nightmares. They may feel constantly on edge, anxious, or emotionally numb. It's also common to avoid people, places, or situations that serve as a reminder of what happened. It's crucial to understand that PTSD is not a sign of weakness. It's the brain's natural, though distressing, response to an overwhelming and terrifying experience. It's a survival mechanism that has gotten stuck in overdrive, and it requires specialized support to process and heal. Next, let's talk about autism spectrum disorder, or ASD. Autism is a neurodevelopmental condition that affects how a person communicates, interacts with others, and experiences the world around them. It's called a spectrum for a very important reason. It looks different in every single person. For some, it might mean struggling to interpret social cues like body language or sarcasm. For others, it might manifest as having deep, intense interests in specific topics. Many autistic individuals also have incredible, unique strengths, such as an amazing capacity for memory, a brilliant mind for logic and patterns, or an exceptionally creative and artistic viewpoint. Autism isn't a disease that needs to be cured. It is a fundamental difference in how someone's brain is wired, a unique and valid way of experiencing and perceiving the world. Now, let's move on to ADHD, or Attention Deficit Hyperactivity Disorder. This is another condition that is frequently misunderstood and often stereotyped. ADHD affects executive functions in the brain, which impacts things like focus, impulsivity, and energy regulation. It's not just being bouncy or not trying hard enough. For some, it can feel like a constant battle to concentrate on a task or to sit still. For others, it might show up as being forgetful, disorganized, or acting on impulse without thinking through the consequences. But it's not all challenges. ADHD is also associated with a ton of amazing strengths. People with ADHD are often incredibly creative, energetic, spontaneous, and possess a unique ability to think outside the box and solve problems in innovative ways. Then we have OCD, or Obsessive Compulsive Disorder. This is far more than just being tidy or liking things organized. OCD is characterized by a cycle of obsessions and compulsions. Obsessions are intrusive, unwanted thoughts, images, or urges that cause significant anxiety and distress. Compulsions are the repetitive behaviors or mental acts that a person feels driven to perform in response to an obsession. For example, someone might have an obsessive fear of germs and contamination. The compulsion might be to wash their hands dozens or even hundreds of times a day. Even though they may logically know the behavior is excessive, the compulsion feels absolutely necessary to temporarily relieve the intense anxiety caused by the obsession. It's a difficult and exhausting cycle to be caught in, and it often requires professional help to break free. Next is bipolar disorder, a mood disorder known for its extreme shifts in mood, energy, and activity levels. These shifts are far more intense than the normal ups and downs most people experience. During a manic or hypomanic episode, a person might feel euphoric, full of energy, and incredibly confident. They might talk very fast, jump from one idea to another, take big risks, and need very little sleep. Then this can be followed by a depressive episode where they feel overwhelmingly sad, hopeless, exhausted, and withdrawn from life. These mood episodes can last for days, weeks, or even longer. It can be a very disorienting and challenging condition, but with the right treatment, including therapy and medication, many people with bipolar disorder are able to manage their symptoms and live full, stable, and productive lives. Let's talk about borderline personality disorder, or BPD. BPD is a condition marked by intense, fluctuating emotions, instability in relationships, and a shifting or unclear sense of self. Someone with BPD might experience a profound fear of abandonment, which can make relationships feel very precarious. They might swing from idealizing someone to devaluing them in a short period. They may also struggle with impulsivity in areas like spending, relationships, or self-harm. Life with BPD can feel like being on an emotional roller coaster without any breaks. However, it's so important to know that people with BPD are often incredibly empathetic, passionate, and deeply caring individuals when they feel safe and supported. With therapies like DBT, people with BPD can learn skills to regulate their emotions and build healthier lives. Now for anxiety disorders. These are much more than just feeling nervous before a big presentation. Anxiety disorders involve persistent, excessive fear and worry that can feel overwhelming and impossible to control. This can manifest in several ways. Generalized anxiety disorder involves constant worry about a wide range of things. Panic disorder involves sudden, intense episodes of fear called panic attacks. And phobias are intense fears of specific objects or situations. No matter the form, anxiety can take over daily life, making it hard to work, socialize, or even relax. The great news is that anxiety disorders are highly treatable. Through therapy, lifestyle changes, and sometimes medication, people can learn to manage their anxiety and reclaim their lives. Next, we have substance use disorder, or SUD. This happens when the use of alcohol or drugs becomes compulsive, harmful, and difficult to control, despite negative consequences. SUD is a complex condition that physically changes brain chemistry. It creates intense cravings, leads to building a tolerance, needing more to get the same effect, and causes withdrawal symptoms when use is stopped. It's critical to see SUD for what it is, a medical condition, not a moral failing or a lack of willpower. People struggling with addiction deserve compassion, support, and access to treatment, not judgment or shame. Recovery is a challenging journey, but it is absolutely possible. Let's discuss major depressive disorder, often called clinical depression. This is so much more than just feeling sad or having a bad day. Depression is a persistent and pervasive low mood that can last for weeks, months, or even longer. It drains a person's energy, robs them of interest or pleasure in activities they once enjoyed, and can fill them with a sense of hopelessness. It can affect sleep, appetite, and concentration, making even the simplest daily tasks feel impossible. But please hear this, depression is treatable. With the right support, like therapy and medication, many people can and do recover, finding joy, purpose, and hope again. Now, let's touch on eating disorders. These involve complex and unhealthy relationships with food, weight, and body image. This can include conditions like anorexia, which involves severe food restriction, bulimia, which involves a cycle of binging and purging, or binge eating disorder, which involves episodes of eating large amounts of food without control. These conditions are not simply about food. They are often deeply tied to underlying struggles with low self-esteem, anxiety, a need for control, or past trauma. Eating disorders are serious medical conditions that can have severe physical and emotional consequences, but recovery is absolutely possible with a dedicated team of professionals and a strong support system. Finally, let's address schizophrenia. This is a serious mental disorder that affects how a person thinks, feels, and perceives reality. Someone with schizophrenia may experience psychosis, which can include symptoms like hallucinations, hearing voices, or seeing things that aren't there, or delusions, holding strong, false beliefs that aren't based in reality. Their thinking and speech may also seem disorganized. Contrary to harmful stereotypes often seen in movies, people with schizophrenia are not inherently violent or dangerous. In fact, they are more likely to be victims of violence. They are human beings who are often misunderstood and stigmatized, but with proper care, medication, and support, they can live meaningful and fulfilling lives. So there you have it, a brief overview of some of the most recognized mental health disorders: PTSD, autism, ADHD, OCD, bipolar disorder, BPD, anxiety, substance use disorder, depression, eating disorders, and schizophrenia. My deepest hope is that this video helps you see these conditions not as personal flaws, but as what they are: real medical and psychological challenges that deserve the same compassion, understanding, and treatment as any physical illness. Remember, having a mental health condition does not define a person's worth or their potential. We are all more than our struggles. I'd love to hear from you in the comments. Which of these conditions do you think is the most misunderstood in our society today? Your insights are so valuable. If you found this video helpful, please give it a thumbs up and consider sharing it with someone who might benefit from this information. And don't forget to subscribe for more content on mental health, self-care, and personal growth. Thank you so much for watching, and as always, take care of yourself because you truly matter. Keep shining.